everybody. My name is Keely Spring. I'm a licensed marriage and family therapist in the state of California. And today I have with me Bernice, and looking forward to hearing a little bit more about what Bernice does. She's actually in a different state. I'll let her introduce herself and share that. So, to that end, Bernice, would you mind kind of sharing your niche, the kind of populations you work with, where you're located?
Yes, of course. Thank you for having me, Kelly. I'm really, really excited. So my name is Berenice Torruco. I am Hispanic, so if you see me online, it might be Berenice, but usually mostly people call me Bernice. I live on the border. I am from Texas. And as far as my niche, I specialize in anxiety, OCD, and trauma. But pretty much 90% of my clients are have been diagnosed with OCD. So that's pretty much what I work with the most.
Okay. And Bernice, do you work with mostly individuals or couples or families?
For the most part, it's individuals.
Uh-huh.
I am open to working with kids, but for the most part, it's been pretty much like young adults. But I'm open to working with all ages.
Great. Um, we're going to dive in because I've got tons of questions about the
Yeah.
OCC
Awesome.
work you do. But before we kind of dive into more of those clinical, could you just share with the audience how you became a clinician? How did you decide to pursue this work?
Yes. So I decided I wanted to be a clinician in high school. And I was very inspired by one counselor that I have. I had a really, really amazing school counselor who really helped and supported me a lot throughout high school. And so I kind of wanted to be that person for others, be that person that I didn't have growing up, until I met him. And so that was a really, really big motivation for me.
Hmm.
So that, inspired me. I first got my bachelor's in psychology, and then I said, I'm going to go back to school. I had got my master's in school counseling. And so before being like a clinician, I was a school counselor.
Uh-huh. So, and what ages was it like high school, middle school?
So I was a school counselor at a high school, but I worked at a very, very special high school in Austin, Texas. There was only 100% for immigrants. And so the one thing that all students had in common was that nobody spoke English and, students from all over the world, but, with a lot of trauma, very heavy cases, but definitely a very, very special place to work with.
Yeah. And how many years? So you said you did that for quite a bit. How many years?
I did the school counseling for 2 years.
For 2 years. Okay. And then pivoted straight to private practice or?
Yeah, so I was doing school counseling, but I was also doing my hours for private practice for clinical license. And I was doing both at the same time. I finished my hours. I went into a community clinic. I did that for a few years, and then I decided to go for my own practice. Currently, I have my own private practice. And so it's been pretty amazing.
Yeah.
Yeah.
And just because I'm meeting people from different states, and so I'm always kind of curious, what is the license? I know the process for California, but what is the licensure process for like Texas? Is it, I'm assuming hours and then
It is, we need to complete 3,000 hours. Yes.
yeah.
So once you get those 3,000 hours and the hours of supervision, then you can apply for what is a full license.
Okay.
Yeah.
And then I'm assuming you have to take a licensing exam or some sort of,
So
yeah.
usually the licensing exam here in Texas, we take it before even being able to complete our hours. So we have to pass the test and then we can continue with actually doing the hours. So technically, like the hardest part is already there. It's just, yeah.
Yeah, that would actually kind of be nice. You're just focused on the hours rather than also the,
Having to
yeah.
study.
Yeah.
Yeah.
Definitely a lot of work. What do you like about being a clinician? What do you like about your job?
I love being able to help. One of the reasons why I specialized in OCD was because I myself have suffered with OCD. And my OCD started in high school, but at that time, nobody knew what it was. I did not know what it was. I didn't actually learn that it was actually OCD until I was in grad school. So that's one of the things I love about it is that I'm able to help in a very special way. I don't know how it is in California, but in Texas, there is a big need for therapists who have experience with OCD or with ERP. And so there's a really big need for it, and there's not enough people doing it. And so I think that's one of my favorite parts is that I'm able to do something that not only is special to me, but it's heavily needed.
Um, yes. So you mentioned ERP.
Yes.
What can you just explain for the audience?
ERP is exposure response prevention therapy. It's considered to be the gold standard when we're treating anxiety and OCD disorders. And so that is one of the three approaches that I do.
Beautiful segue. So can you talk to me a little bit about the modalities and how you kind of go about treating
Yeah.
OCD?
So when clients come to me, like I let them know we will either do EMDR, which is also very helpful for OCD, but usually we try to start with ERP. And so with ERP, mostly what we're doing is we're doing exposures. We identify what their fears are. We do exposures around those fears, targeting it, while at the same time, the response prevention is learning how not to do the compulsion, delaying it until we completely eliminate. That is the overall goal. And then the third approach that I sometimes do is lens neurofeedback. And then other times I'll do all three at the same time. So just depending on client goals, what they're open to doing as well, because well, ERP and EMDR are considered pretty intense approaches. And so it also depends on how open they are and how ready they are to actually address their fears.
Hmm. Yeah, so I recently was in a continuing education thing about OCD, and they were talking about ERP. Uh, could you just, so for the audience sake, because I do think it is really powerful when we're talking about exposure. You gave a good overview, but in practicality, what does that look like? Like, what could a common fear be, and then the kind of exposure be?
So the fears can really range from person to person, and there really isn't like anything can be a fear. But when we're talking about OCD, we have different subtypes. And so I can name a few, but that doesn't mean that those are the only ones. And it can be anything from like fears of harm, such as like, what if I hurt someone, or what if someone gets hurt, or what if someone dies? Can be fears of contamination. What if I get sick from touching something, or what if I make other people sick? But then it can even go to interrelationship. Like, what if I'm not with the correct partner, or what if there's somebody better out there for me? And so because we have all these fears that sometimes come back to our core beliefs, we kind of work with how they're getting in the way and how they're keeping us from being who we should really be.
Uh-huh. And if I was going to practice exposure, for example, with one of the one examples that you just said, what would that just be avoiding the thing, or would it be, like touching a door handle and holding the door handle for a
So
while?
it's definitely anything aside from avoiding whatever the fear is. So holding the door handle could definitely be it. So depending on the fear, we can either do something like sometimes I have clients who are not ready to do like in vivo exposures because they can be imaginary, live, or in vivo, which is the end goal. But if we are not ready to like go do the thing that we are afraid of, then we expose ourselves gradually. And that can be with anything from like, hey, let's watch a video of someone doing it. Let's watch some pictures of what the doorknobs look. Let's imagine touching the doorknob, or let's write about what would happen if we were to touch it. So we do different types of exposures around the same fear until we are able to actually be in that experience of like, you know what, I am touching the doorknob and I'm okay with that.
Uh-huh. And is there a typical, like with EMDR, right? There's, I believe, 12 protocols. Is there lens? I don't know if there's how many,
Unless I believe it's also 12 to 20. Yes.
12 to 20.
Yeah.
What about OCD for ERP?
So it's also pretty much the same. What the research shows that is with at least 12 sessions, you should see a significant improvement in your symptoms. And so it does depend from person to person, but the goal of ERP is that it's short term. My when I see clients is like my goal is that you know how to do this. By the end of when we're done, you're gonna be able to do this on your own and you no longer need me. So it is definitely it's very, very intense, but it is short-term therapy. where, it's not something that we're going to be doing for a long time.
Mhm. Mhm. Yeah, that's been my experience with just the little amount of people. I certainly do not have the expertise you do with
Yeah.
OCD, but with the amount of people it is actually fast moving when you work with that exposure. It does feel like you can make traction pretty fast.
Oh, yeah. Yes.
So to that end, what does a typical session look like for you? I mean, I guess it would depend on the modality, but is it, organic or more?
Yeah. It's very definitely very structured for me. Because I feel like even EMDR is pretty structured. We're reprocessing some trauma, but if we're not doing EMDR and we are doing ERP is also pretty structured. So by the time clients come to the session, they kind of already know what they're going to do. So we'll talk about it the week before, and it's like if we're going to do an exposure, kind of give you a heads up, give you that time to prepare and agree like, hey, do you want to do this exposure, so that the next week when they come in, we follow through with the exposure. But I feel like, well, for me, EMDR and ERP, I feel like they're so closely related. Like I think that's maybe one of the reasons why it's so easy for me to integrate them together. But yeah, it is very, very, very structured, very goal oriented, and we always have something already prepared and in mind. And
Uh-huh.
yeah.
And just for my own curiosity, what if somebody were to say like, "Oh, nope, I don't want to do that."
It happens. It happens. So we figure out what can we do.
Uh,
Um, and so we're not ready to do an exposure, then what can we do? What can we do that's gonna lead us to that? And then sometimes it's like, okay, we just need to hold space and we can definitely do that. But yeah, we'll figure it out.
you kind of work with them to figure out where that comfort level is, and yeah,
Yeah, definitely.
yeah. And are you doing this mostly in person, or is this hybrid online, or?
So I was pretty much almost all virtual. I recently acquired a new place where I can now be in person. So I do offer myself in person, but the majority of my clients are all over Texas. And so it is probably about 80% virtual. Also because ERP does work a lot better virtually. And so in the sense that like if sometimes we'll have a client who one of their fears is going to a grocery store. So while they are connected with me, I'm in my office, they will have a trip at the grocery store and I'll help them walk through it. So when it's situations like that, being virtual is a really, really great benefit. But I am available in person as well.
Uh-huh. Yeah. Um, is there any things that I didn't ask you about OCD that comes up that you think people would be like, curious to know, or kind of the standard things that you find
Yeah.
yourself telling people about it?
I think that what keeps coming up the most is that I feel like when we talk about OCD, people already have an idea that OCD is being clean, being organized, maybe a little bit of perfectionism, which could happen definitely. But it's not just about being clean and organized or wanting things a certain way. Like there is so much fear underneath that can definitely cause a lot of pain. And so I feel like there's a really big misconception that sometimes people think like, oh, OCD is a great thing because my house is going to be clean. But in reality, like there can be so many dark thoughts behind that.
Mhm. Yeah, and it really is the obsession about the thoughts and the compulsion to do something about them that really kind of drives the behavior rather than,
Oh yeah.
you know, some drivers of perfectionism. And it's my understanding too. I think people sometimes get, at least for me, they get confused with OCPD versus
Oh
OC,
yeah.
right?
Mhm.
And OCPD is obsessive compulsive personality disorder, which is tends to have a more of that perfectionistic framework versus
Yes.
OCD, which is more about that compulsion.
Yes. Yes.
Yeah. All right. Anything else before I kind of go back to my questions?
No, I think we got it.
Yeah. Okay, well, so is there anything that surprises you about therapy?
I feel like therapy surprises me every single day, because you never know what you're gonna get. But one of the things that's really, really surprising, is that clients are very resilient, at least the population that I work with, especially because when I asked you to do ERP, I'm asking you to do something that's pretty intense. It's very uncomfortable. But what really surprises me is that, it's really painful for some clients to go through exposures. It is very difficult. It is very challenging, but they keep coming back. And because they keep coming back, they start to see the results, the improvement. And so, but yeah, but just the resiliency itself, I feel is like it's pretty amazing to watch how people come do hard work in therapy and, yeah.
Yeah. It's one of those things that when people show up in that like kind of wholehearted way to
Oh, yeah.
things, it can be
Yeah.
um I, I feel a great deal of respect and honor that
Oh,
people
yeah.
um but it can be a surprise certainly of like wow. Yeah.
Yeah, yeah, because it can definitely get pretty intense in the session sometimes. And sometimes it's like, well, the first immediate thought is like, well, why do you want to make yourself feel bad? Because sometimes ERP is about increasing that window of tolerance and learning how to sit with the emotions. And so I do get at the beginning, sometimes I can get some pushback of like, why do people do this? But then once they do it, they realize like, oh, I can actually do this. And that itself is also very empowering for them.
Yeah. Okay, is there anything that you wish people knew or understood about therapy? We talked a little bit about around OCD, but is there anything else that we didn't
Yeah.
kind of around therapy in general or
For me, the biggest thing is that we nothing has to be broken in order to be in therapy. I feel like a lot of people always feel like something needs to be wrong. Um, and even if it's not OCD or, we're coming for like to help with a specific concern, therapy in itself can be beneficial in so many ways. Because, when we talk about just developing self-awareness in itself, you don't have to have something broken or something wrong or something that needs to be fixed in order for you to continue to learn about yourself. So I think that's one of the biggest things for me.
yeah. That seems to be a theme with therapists that we really want to get the message out that things don't
Yeah,
have to be to a point of extreme to come and get some support and do some kind of, work around
yeah,
yourself. You
yeah, definitely.
Okay, so final question in this kind of clinical area before we get to know you a little bit better. Uh, is there a tool that we could share with the audience, something that is
Mhm.
accessible that people could use?
I think that one, being a therapist who mostly does ERP, that's a little difficult one for me. Because when we talk about doing ERP, it's more about finding it within. You being that internal tool for yourself that you can control how to tolerate your distress. And so when I think about like a specific tool, I would say that we ourselves are our own tool, that we want to learn how to use that to our benefit, how to use that to help us in difficult situations. So yeah, I don't know if that answers your question, but
No, I think it's a totally valid point. So it's we need to get in tune with our own bodies, our own minds, what's kind of going on with them so that we can then resource ourselves.
yeah, definitely. We are our resource. And so when we're talking about doing ERP, one of the biggest things is like we want to learn how to tolerate that distress without doing something that's going to make us feel better. And so when we try to incorporate tools, it's like, well, you're helping yourself feel better, which is also very fair. If we need to, we definitely want to do it. But more than anything, use yourself as a tool, use yourself as a resource, learn how to manage the distress until you know it's no longer distressing to you. And
Yeah.
so it's also a tool that you can take with yourself with you everywhere. So
Yeah,
yeah.
I'm kind of laughing because I had a client a while back that kept wanting me to give the answers, kept wanting me, and they'd come with like a set of markers and they wanted to like color code and just have me give them a play-by-play of every moment of the day and what they should do.
Yeah.
And got really mad at me when I was like, not gonna do it. Sorry. Like let's get you to a point. And then I remember months later she came back and was like, thank you. Like I needed to be my own resource. I needed to be my own
Yeah.
advocate, and I was using this as a crutch to try to,
Oh
you know,
yeah. And I think it's a even for us as therapists, like it's a hard position with us because we see someone sometimes stuck in that suffering. Um, but us helping them is not gonna help them get unstuck. So
Yeah. It's like we're trying to help them without just giving them what answers might be for me, because for
Yeah.
them it might be a different answer. It
Oh,
might, something completely different.
yeah, definitely.
Yeah. All right, Bernice, thank you so much for that. Are you ready to be seen on a more personal level here?
Yes, I think so.
Okay, so we'll start out with the easy one. What is something that is making you happy right now?
Oh, I think right now probably I would have to say, career-wise, I feel like I'm in a really good place. We just got a new location. We are now offering more in-person sessions, which when it comes to the location where I'm at, small border town, there isn't a lot of mental health offered, and so that is definitely one thing. In a personal level, I feel like I'm really happy right now with my relationship. So I would definitely have to say that being in the right relationship makes a difference with how you feel.
Yeah, 100%.
Yeah.
I can resonate with a bunch of that. And I didn't ask this, but I actually got in touch with you through CO,
Oh,
right? And we were talking a little bit about these kind of desert mental health desert kind, and it sounds like what you're describing, you're in one of them
yes.
a little
Yeah.
bit.
Yeah. So I am in CEO's second cohort of EMDR. I was trained by CEO's program. And so that has also been pretty fascinating because we're about to start, I believe, the third cohort in which I am now also EMDR consultant in training. So now it's kind of like my turn to start giving back and helping the other trainees.
Uh-huh. Yeah, it's such a I love that program and what she's doing
Yeah.
with it because
Oh yeah.
it
Yeah.
really is trying to answer this. There's nobody around. Who's around? Let's train up some people.
Yeah, it has been very, very helpful for me because of, I think one of the biggest things that I've gotten from it is having that collaboration where it's a big group of us. I think we're probably now there's at least 20 of us. So just being able to have someone to come back to and like, hey, can we talk about it? Or, just have that collaboration is really, really helpful because before that, there was none of that. But not only that, like when I did the training with SEAL, I really thought I was gonna go do an EMDR training and then be done, never see these people again. And so it's been about 3 years later, and we are still pretty united, pretty close. And so I think it has been awesome.
Yeah, I love it. I love it. Okay, taking a little different turn. What's your favorite app?
My favorite app, I definitely use SEAL's app a lot. When I do EMDR, that's something, um, but I also do a lot of the admin work for the private practice, and the app that I use all day long is called TDC, which is, work related. But yeah, it's actually pretty amazing too. So
Uh,
yeah.
for the audience, will you just name Sia's app? So I'll put it,
Yes, CEO's app is the Got This app.
I'll add it under here as well. So,
Yeah, yeah.
okay, beach or mountains?
Oh, mountains. Yeah,
Yeah,
I
like, do you like hiking in the mountains or?
I do. I love hiking. I love the outdoors. I mean, the beach is also really nice, but I feel like there's a bigger grounding effect for me when you're just around the trees and mountains. And yeah, definitely mountains.
Okay, what is one thing that movies never get right? So many
Um,
at once.
so many, I know, so many things, so endings to start with. But yeah, I feel like I think when they just don't get the ending right is it's not fun.
You mean like when they just kind of wrap it up in a nice tiny little bow and are like, oh,
Yeah, and you're like, I still want some more. Yeah,
fair. Fair. Okay, what's the best way to relax?
best way to relax. For me, it's being outdoors. I love being barefoot, walking outside. I do a little bit of earthing, just taking in some fresh air. And I feel like anytime when I'm outside, I don't, Laredo does not have a lot of trees, which is very unfortunate. But I do have a nice garden with nice plants. And so just being able to be in nature is what really, really helps me the most, the fastest too.
Yeah. Yeah. I definitely 100% agree with that.
Yeah,
Nature is so healing on so many
it
levels.
is. It is.
Okay, dream trip location. Is there anywhere you'd like to go?
Dream trip. Um, I think I would have to say the Northern Lights.
Ah, yeah.
I've been close to them, but I haven't actually been to them.
Yeah.
So that is definitely on my top of my list, especially because I know that these few next years it's going to be very visible in the United States. So maybe hopefully, it'll come true. But the Northern Lights is,
Yeah.
yeah,
Yeah, I'm with you. It's one of the top ones on my list. And a few months ago, so I'm in the Bay Area, and they were like, "Oh, you can see a little bit of the Northern Lights, but it was just like red glow. It wasn't like, you
yeah, the
know."
blue greenish, yeah.
Yeah, exactly. I was expecting a little bit more, so I'm like, I gotta get actually up there. I can
Oh
actually.
yeah,
Yeah,
yeah.
yeah, I'm with you. Okay, what advice would you give your younger self?
My younger self. I think that it's okay to take your time. In the sense of like it doesn't have to be rushed. There's no timeline. You don't have to do certain things by a certain age. It's forget about the expectations, definitely.
Yeah, it's more about the journey than the
Oh yeah,
destination.
oh yeah, definitely. Yes.
Yeah, I agree. Okay, out of the four seasons, which one's your favorite?
Hmm. Depends where I'm at.
That's fair.
Oh, it depends where I'm at because Laredo is really, really hot. And so summers in Laredo are not pleasant. But summers somewhere else are pretty nice. But maybe I think I would have to say summer. Yeah, definitely summer.
Right. So current season.
Yes.
Fair. Okay, we've got three more questions here. First one, what would be the worst superhero power to have?
Where's the one? Um, Let me think. Hmm, that's a tricky one. Um, I feel like, hmm, I think like just because when we talk about Flash, I love Flash, but
Oh,
just
like the runner, the fast.
yeah, the speed where everything's like super fast. Um, yeah, and things don't have to be so fast.
Fair. Fits nicely with the what we
Yes,
do.
definitely especially when someone who's really highly anxious and our whole thing is about trying to slow down.
Yeah.
So yeah,
Yeah. I think people are always surprised when they're anxious, and I'm like, okay, let's just slow down. And they're like,
it's
what?
hard.
Like, just give me tools to be more efficient.
Yeah, yeah.
It is definitely hard. Okay, what is an animal that resonates for you?
Animal. I love dogs. I have three dogs at home, so I definitely have to say a dog.
Nice. What are your dogs?
I have two golden doodles. Uh,
Oh.
yes. So they're super furry, long fur, and then a little chihuahua. But the golden doodles, I resonate more with them, the chihuahua.
Not
Yeah,
as much.
yeah, yeah.
The
They're
crown comes down.
yeah, just fun, playful, energetic. So
Nice. Yeah. Okay, final question. When you look back at your life, what do you hope you'll be able to say about it?
hmm. I hope that I just want to be, content in the sense of like I did what I could and I don't not have that need to want to go back and change anything.
Hmm.
Yeah. Yeah.
Love it. Thank you, Bernice. You're officially seen.
Thank you so much.
I know I asked you this a little bit earlier, but is there anything else before we hop off here that you would like the audience to know?
I
You did?
think we're good.
Okay.
Yeah. Thank
Well,
you.
thank you so much. And everybody who's watching, I will include Bernice's information below so you can reach out and get in touch. And thanks again. Really appreciate your time.
Thank you so much. Thank you for having me.